Good afternoon, my dear students. Today we are discussing about developmental delay. So, what is the developmental delay? And the next one, which type of symptoms are presented in the baby? So, how to develop the baby? Which type of factors are involved in the factors affecting on the development of baby? So, now we discuss. So, when the child does not reach to their development in milestones, means perfectly up to third months, up to 6 months, up to 9 months after delivery, and after delivery, so up to 1 year, up to 2 years, and continuously grow the children, but and their organs also well developed. So in case of any changes occurs in there, means the first step is a smiling for the first time and having good boy, and the next one unexpected times is called as a developmental. These are the developmental characters. The developmental characters are delay is known as that is called as a developmental delay. So but in the particular period of time, development, their growth and physical properties and as well as the internal organelles also develop. In case of any changes in there is known as the developmental delay. So developmental delay is the learning of these developmental delay milestones has a normal variations around what age children will achieve them. So at the particular age of the children, and they doing the different type kind of activities like walking, like smiling, like talking, and etc. These type of activities are observed in the different ages of the baby. So for example, if the normal age of walking, so walking normal age is the 9 months to, so 9 months to 15 months time. So and child still is not walking by up to 20 months. So normally child walking time is the 9 months after delivery, 9 months to 15 months. He try to standing, and the next one try to walking also. So in case up to 20 months there is no chance for the walking, there is no chance for the standing of the baby, is known as a developmental delay. So the developmental delay is would be considered as a developmental delay if a child is temporarily lagging behind. It is lagging behind, that is not a called developmental delay. So here the particular age of the baby, compulsory they doing the different type of activities starting in our body. So in case of any changes in there, that is called as the developmental delay. In case of there is no chances, so sometimes of other activities are presented, that is not considered as a developmental delay. And the next one, so causes of the developmental delay. What is the causes? So developmental delays have many causes, like number one is the genetic factors. Number one is the genetic factors, complications, the pregnancy complication, and the next one prematurity, infections, any other presented in the baby, any other presented in the mother. These type of activities is these type of symptoms are present in the body. It leads to the developmental delay. So if these causes were detected early, they can easily treated, it can easily detected, and it can easily treated. So how to treat it? So the major risk of factor developmental delay are adverse neurodevelopmental outcome material and child factor. So different types of kinds are there, are determination. And the next one, treatment of the developmental delay. So which type of factors are presented? One is the maternal factor, one is the maternal factor. So maternal factor means, so mother related factor. So mother related factors also causes the developmental delay. What are there? Number one is the age of mother under 19 at the delivery. So in case of mother age below 18 years, below 18 years, so in case of delivery below 18 years, it leads to the developmental delay chances occurs. And prenatal caring beginning after the third month of pregnancy. And then next one, tobacco uses, alcohol uses at the duration of the pregnancy. And these are some factors. And sometimes, so the mother suffering with the anemia, poor nutrition, any infections, diabetes, hypertension. So these type of these type of characters are present in the mother. It leads to the developmental delay. And complication of labor and, and other deliveries. So the any complications occurs in the delivery, so at that moment also the developmental delay occur in the baby. These type of characters are present in the only mother. And the next one, Child factor. So child factor is the gestational age less than 37 weeks. So 37 weeks gestational age means, so inside of the mother, baby is present in the inside of the mother, so up to 9 months. So after completion of 9 months, they mother going to deliver. So in case of before the 9 months, so it happens the developmental delay occur in the baby. And the next one, birth weight 200 2500 grams means 2.5 kgs. So after delivery, the baby weight is normal baby weight is 250 2.5 kg to 3 kgs. In case of these values are decreases, it leads to the developmental delay. And multiple births, so means twins, triples, and a number of members are presented in the mother womb and after delivery. So after delivery, it leads to the these type of disorders are presented. And the presence of newborn medical conditions such as anemia is presented, and gestational abnormality, any abnormalities is present in the baby, it leads to the developmental delay. These are the mother factors and children factors. How to diagnosis of that this developmental delay? So this is very difficult. So to diagnosis of the developmental delay, it cannot easily determination, it cannot easily identified. So there are no physical tests, so no physical tests available confirm this particular developmental delay in the baby at the duration of the pregnancy. So observation and detailed study behavior of the suspected child is only one way developmental delay can be diagnosis. So it is observation period. So how to movements, how to move the baby in the mother womb. And the next one, after starting at the eighth month, especially eighth month of the mother, at the duration of the pregnancy at the eighth month, after taking breakfast, after meals, after lunch, after taking of food. So before the 2 hours, the baby movements is a four movements is presented. So up to 2 hours, time. In the 2 hours time, the baby movements are occur in the mother womb. Four kicks are from baby, and that one is observed by mother only after taking the breakfast or lunch or dinner, any other food material entering in our body within 2 hours. It compulsory four kicks are observed. In case of these four kicks are no chances, it leads to the developmental delay occur in the mother. That is the one. So that one is a mainly observation and detailed studies of behavior of the suspected child. Only way the developmental delay can diagnose is only observation, detailed study of the behavior. And then here the observation is not a casual one, but is carried under guidance of the pediatricians, doctors, and nurses. So these members are, it gives a proper guidance. So how to identify the baby movements, how to diagnosis of the developmental delay, the proper guidance given by this following peoples like pediatricians, doctors, and nurses also. So the next one, so this one is the diagnosis of a developmental delay detected by the two ways. One is the developmental screening, and second one is the developmental evaluation. Developmental screening and developmental evaluation. What is the developmental screening? So it is usually done by doctors or nurses. Tell if the children are learning basic skills when they should, are learning difficulties in the difficulties for the child. So these are the learning skills, and their activity skills are there is no chance for the presented in the baby. So here is done by the doctors and nurses. So how to, so the parents may ask the some basic questions about their children behavior. So what is the children behavior, what is the activities of the baby, and what is the food intake, and these type of behavior characters are identified by doctors, asked some basic question to parents only. And the next one, and examine child by talking or playing with him. So these type of developmental delay characters, how to examine after delivery how to examine, doctor doctor play with the baby, so and identify the physical characters. And then next, during the examination of the doctor, observe the how child responds, speaks, learns, and behavior and movements. These type of characters are examined. The result screening test does suggest a child may have developmental delay. The child should be referred for developmental evolution. So these type of characters, developmental delay characters, are identified by doctors. So the first observation from parents and second observation from children, what is the behavior characters, and examine it. In case of a developmental delay characters are presented in the baby, so it going to evolution. So that is a developmental evolution. Developmental evolution is an in-depth assessment of child skills and should administered by highly trained professionals. So it one is how to identify highly professionals. So who is the sorry for the disturbance one. So highly professional like a psychologist, developmental pediatrician, or pediatric neurologist. So with the using of these three members are the evolution of the developmental delay characters. So here, if delays are suspected in only one area, child may be referred to as a specialist in that area, such as physical or occupational therapist or speech languages pathologist. So different type of kinds of peoples are treated this baby. And then so the results of developmental evolution used to determine the child need further diagnosis test and interventional services. So these are all our interventional services, diagnosis tests, and treatment of plan. These are evaluated under evolution. So what is the treatment after that? So these type of characters we are determining the baby is going to developmental delay characters are presented in the baby. So what is the treatment? So here the children are unequal, each has children way their growth and development. Treatment plan very unequal in account be designed of the focus on individual. What are they like? First one is speech and language therapy, occupational therapy, physical therapy, behavior therapy. These type of therapies are treatment for the developmental delay. So this is about the developmental delay and the characters of the developmental delay and causes, symptoms, and the next one how to identify it, how to diagnose, and what is the treatment of developmental delay. So this is about our topic. If you have any doubts from this topic, tomorrow we will discuss. Thank you.